Hi everyone. On behalf of the World Health Organization Department of Aging and Life Course and the International Federation on Aging, I'd like to welcome you to the inaugural webinar of 2019 on age-friendly environments. Today's webinar is titled Age-Friendly Housing, Promoting Healthy Spaces for All Ages, and will feature presentations from the WHO and from winners of the Innovation at Home contest, which was WHO and Grantmakers in Aging initiative. The Innovation at Home contest was introduced to identify successful age-friendly housing innovations around the world. On behalf of the IFA, I'd like to thank our presenters for being with us today and invite all participants to ask questions via the questions tab on GoToWebinars. All questions will be given time at the end of the webinar, but if your question isn't answered, I'd invite you to email the IFA and ask that question that way. You'll also receive further information in a wrap-up email at the end of the webinar. So thank you for listening, and I look forward to hearing your questions at the end of the webinar. I'd like to now pass the presentation on to Ramona.
Okay, hello everyone. So my name is Ramona Ludov. I'm working as a technical officer at WHO headquarters in Geneva, and I'm working mainly on WHO's housing and health related activities, as well as on health and all policies approaches. And we're very excited to be able to talk at this webinar today about our housing related work and give you a bit more information about the recently published WHO housing and health guidelines. Just a brief outline of our presentation today. So I'll quickly talk about the relevance of housing for sustainable development and public health, WHO's response to this increasing need, and then give a short outlook on our planned activities in the future. So housing is becoming increasingly important, and this goes on a general level. So the world's urban population is expected to double by 2050, and of course they will also require housing solutions. And then from a more specific perspective, we're also expecting the population aged over 60 years to double by 2050, and they will require more specific housing solutions. Plus, there are changing weather patterns associated with climate change, and this also calls for a need to adapt the way we live and the way we reside in our housing to climate change. So we see that there's a global relevance of the issue of housing, and this goes for high, middle, and low income countries, and regardless of geographic region. If we then look a bit more into housing related to health and the global development agenda, we can also answer the question why WHO is working on housing. And this is simply because we perceive housing as a public health issue. So when we think about the sustainable development goals, we see that housing can contribute to the achievement of several of those SDGs. One being SDG number 3 related to health, but also when we think about healthy cities, number 11, or about quality education, how housing can improve people's ability to stay at home, to study and learn and develop. So we see that housing is a cross-cutting issue that requires multi-sectoral attention. If we think now about housing from a health perspective, I just would like to show you this diagram to highlight how manifold the ways are in which housing can affect human health. And just to name a few, we can see that housing influences, for example, our cardiovascular disease, our respiratory health, mental health, well-being. It can lead to infectious diseases. It can have an influence on whether cancer is developed. It can influence our hearing, and it can also lead to injuries if there is poor housing. And if we go down in this diagram, we see that there are a lot of different pathways through which housing can influence our health. So we think that it is a very important public health issue, even though it's not always perceived as this when we think about housing in the first place. So WHO's response to this increasing need of having healthy housing for all, across all ages, WHO has developed the WHO Housing and Health Guidelines. And this has happened also on a request from member states who wanted to have more guidance on how to deal with this issue of housing from a health perspective. And we also hope that these guidelines will increase visibility of housing in the health sector. Just a few words on the content of the guidelines and what they aim to do. So they set global norms and standards based on the best available evidence. That means that we had a thorough review of evidence of all the single topics that are covered in the guidelines, and then based our recommendations given in the guidelines on this evidence. They focus on an entire sector instead of just a single disease or a single issue of housing, and as such give a very comprehensive perspective on the topic of housing and health. We hope that these guidelines will enable the health sector to inform other sectors about how housing impacts health, and then that we find together solutions on how to work together to make housing healthy and suitable for everyone. And so they mainly target policymakers that will then formulate policies that take health into consideration when talking about housing policies and regulations, but also implementing actors who would then carry out the recommendations made in the guidelines. Just a few words on the process of guideline development at WHO to contextualize a bit more the information we give in the guidelines. And this is a very rigorous process we have to follow. That is a standardized process. So usually we identify priority issue, have a member state request, and then have a standardized development procedure. We convene experts for a guideline development group, an internal steering committee, and external peer reviews to make sure that we have experts from all fields that we cover, and also can combine from various geographical regions, from various sectors, all the experts to make sure we have a very comprehensive stake on the issue we address. We then commission systematic reviews to compile the best available evidence and blend this systematic review evidence with considerations of feasibility, costs, acceptability, benefits, and harms, to ensure that we're not just looking at evidence per se, but also put this into context and see how member states can then implement the recommendations we give. The recommendations are formulated by the guideline development group based on this evidence and these considerations in mind. And the guidelines then undergo an external review process before a guideline review committee in-house approves the guidelines and has, again, a thorough look at them. In terms of context, the WHO Housing and Health Guidelines make new recommendations on areas such as crowding, indoor temperatures that includes excess indoor heat and cold, as well as insulation, home injury prevention, and accessibility. And we provide a summary of existing WHO guidelines that link to housing, that cover indoor air pollution, toxic materials, noise, and water sanitation and hygiene. So when we talk about age-friendly housing, accessibility is of major importance, and this is why I would like to focus especially on this chapter of the guidelines. So we have arrays of functional impairments in aging societies, yet most homes are not yet built with accessibility in mind. And we expect that these functional impairments are also going to increase as the world population ages. When we look into experience of people with functional impairments, we see that they often face discrimination and higher costs when looking for housing, but we also recognize that environmental factors mainly determine whether an impairment is perceived as disabling or not. That means if we provide accessible housing to an aging population, we will also make sure that people can live longer and more independent in their own homes. So if we have accessible housing, we can improve a person's domain-specific functioning. If we do not have accessible housing, we run into the risk of having more falls and injuries. It will restrict social participation and also negatively affect quality of life. So the way how people age in their homes is mainly determined by how we build their housing. Therefore, we gave a recommendation that is called based on current and projected national prevalence of populations with functional impairments, and taking into account trends of aging, an adequate proportion of the housing stock should be accessible to people with functional impairments. So that means based on the trends we see in a specific country, as adequate stock, meaning covering all these people of accessible housing, needs to be provided. We give this recommendation because we do know that it's much more cost effective to build housing that includes key accessibility features than to retrofit them. So if we build new housing, it totally makes sense to build with accessibility and an aging society in mind. And we also think that accessible housing should also consider other factors related to healthy housing, example through universal design, to make sure that all residents can live in this house. And to implement this at country level, we think that the public and private sector are required to work together. So to give you an outlook of what we intend to do with these guidelines now, is we want to work together with our partners from academia, NGOs, member states to develop an implementation strategy, to have tools and guidance that are adapted to country-specific priorities and needs. The situation is always different depending on where we go. There are always different priorities. So we need to make sure that our guidelines really meet the needs that are in a specific country. And we want to do so by having different tools like situation analysis tool, a gap analysis, an institutional assessment of what is already there in terms of actors and who can work together. And we'd like to enrich this with a collection of good practice interventions, model legislation, and case studies. And we further think that it's very important that we all work together for housing conditions to improve. And that means we also need to have capacity building and information that promote multi-sectoral action, as housing is inherently a topic that is not just placed, or well, not really placed in the health sector, but has a lot of influence on health. We need to see how we can speak with other sectors to make sure that we all work towards the same goal, to have cost-effective solutions, potentially also having a lot of co-benefits, so address climate change with less emissions, have accessible housing for aging societies, but at the same time also being implementable for a reasonable price for countries. So we think multi-sectoral action is the key here. And we would be delighted if you'd go on our website and read more about what we do in terms of housing and health in general. And if you have any questions that go beyond this, would be happy to answer, and you can always write to us and get in touch. Thank you very much.
Thank you, Dr. Ludolf. At this point, I'd like to hand it over to Sybil. Sybil is from AgeFriendly Sausalito, and she's going to give an example of an age-friendly practice that was used in Sausalito. So, Sybil, I will transfer to you.
Good morning, good afternoon, ladies and gentlemen. I'm honored to be with you today. My name is Sybil Boutellier, and I am chair of AgeFriendly Sausalito in California, USA, and also on the Commission on Aging here in our county of Marin County. So I want to share with you how a small group of older citizens was able to bring about a new housing program and policy, scale it up, and make it sustainable. Sausalito is a small bayside city at the other end of the Golden Gate Bridge from San Francisco. Our population is small, 7,500 persons, and we're already more than 1/3 of the population is age 60 or over in our town. So this is significantly higher than the national average of 21% and the county of Marin's average of 27%, which is projected to increase another 35% by 2030. So faced with this data and experiencing our own concerns about aging in place in our community, our small group of elders decided to ask our city council to appoint a task force to explore how the city could be more age-friendly and to get their agreement to apply to join the World Health Organization's Global Network of Age-Friendly Cities and Communities with the concomitant commitment to undertake a 5-year plan of assessment and age-friendly improvements. So our all-volunteer task force was comprised of older adults in the community, developed and conducted a survey instrument encompassing the 8 domains of livability, which we mailed to city residents aged 55 or older. So 2,400 people received them, and with return mailing, and we got a 50% return, which was remarkable and so helpful. And housing was one of the particular concerns. Over 95% said it was important or very important to stay in their community, to continue to engage in social activities here, and to remain in their own homes as they age. But almost half of them said the design of their homes would not make it easy to remain there as they grow older. And 38 different survey respondents wrote in comments that they would like to make home adaptations, and several added comments saying the process was too arduous, confusing, or expensive to undertake. So a particular concern in our community is the fear and incidence of falls, because most homes in South Toledo are located on steep hills. Most have multiple levels and entry stairs, and the incidence of falls are the #1 reason that older persons in our community get transported to hospital. And the fact that 44% of persons aged 60 and older in South Toledo do live alone exacerbates the danger of injury from a fall. And as research has shown, even the fear of falling can isolate older adults in their home, causing withdrawal from community life, depression, and can result in an overall decline in health. Being isolated from public transportation in our residential areas adds to that situation when somebody becomes injured from a fall and loses their mobility. And you can see the figures here in our country, and in our county, we have the same issues. So armed with all this data, our little task force held a community meeting about home modification, and we invited the city building inspector and one of our associates, a retired age-friendly architect, and we discussed the range of age-friendly adaptations and also the complexity of building permits and their costs. And it was decided by the group in this discussion that we would work with the city to try to figure out how to streamline the building permit process for older adults, so more people would be encouraged rather than disincentivized to make their homes more accessible and safe. A few of us, including our age-friendly architect, worked for a little over a year with the city to craft a new age-friendly permit policy with better pricing and a clear, simple procedure. We reviewed hundreds of modifications and how they'd fit into a policy scheme that would work with a budget the city could accept. And this was finally adopted by the City Council late last year. The city had to agree to forego a portion of building permit fees, which the state housing code authorizes them to collect. So a budget agreement was part of the planning process, and an initial cap was set, which the city included in its biannual budget, in which they could augment as time goes on. So building permit fees are calculated based on the total construction cost of the project. We're getting a big feedback now. Echo. I hope other people can hear clearly. Okay. Building permit fees are calculated based on the total construction cost of the project. So the age-friendly building permit is free for accessibility modifications to homes or apartments based on construction costs up to $10,000, which of course would be different in different countries and cities. It's available to any resident age 60 and also younger adults with any sort of a limiting condition. And renters are eligible with landlord approval for making permanent modifications. So each eligible resident can have 2 permits per year. So that gives them free permits for a total of $20,000 worth of accessible home modifications. And eligibility is based on who is living in the home or apartment. It must be an older person or a younger person with a limiting condition. So here's an example of a project that's eligible for a no-cost age-friendly permit, as construction costs are less than $10,000. So this was a new ramp to a front door with handrails and a non-slip surface. Other things that would fit into that cost would be a stair climbing chair, some simple outdoor lifts, possibly widening a doorway, and some other types of changes. When the total cost of the project is more than $10,000, that amount's deducted from the calculation for the permit fee, and the cost of the permit is based on the remainder of the construction cost. So for this bathroom remodel, which included more than $10,000 in accessible improvements, the permit was based on $14,000 rather than the total job of $24,000. So that gave the homeowner a reduced fee of about 30%, and in some cases it can be up to 50% or so, depending on the overall cost of all the changes they're making, including those that don't have to do with accessibility. And of course, they can get 2 permits a year, and there's no limit as to how soon you can have the second one within the year. So 2 parts of a larger construction project could take place within a couple of months. So along the way, we benefited from the generous sharing of resources by other organizations working to create age-friendly environments. And this is one of the great things about being part of the WHO's global network, because the exchange between the other cities and the other agencies have been just wonderful, a wonderful advantage for us all. And I particularly wanted to acknowledge Canadian Mortgage and Housing Corp. They generously allowed us to license and customize an earlier version of their home modification guide for seniors to use in our community, and they were developing a new one for Canadians, which is just wonderful. Localizing the guide helped us to get our community thinking about the kinds of adaptations needed in their own homes. Marin Community Foundation provided a small grant so we could print copies of the guide, and we've distributed them widely. Now there are some excellent guides that have been made available for use by other advocates. And the new updated guide created by the Canadian Mortgage and Housing Corp, Maintaining Senior Independence Through Home Adaptation, is available in English or French versions. And the AARP's Home Fit Guide is available in English and Spanish, and both can be downloaded online for free or ordered in hard copy. And I've listed their URL addresses on this slide and highly recommend them both. So AgeFriendly Sausalito was excited about the potential for this program and was hoping others would adopt and replicate it. So we promoted the program to other stakeholders and policymakers and advocated for scaling it up. Our state assembly member, Mark Levine, understood the value of the program and introduced a bill in the state legislature inspired by our Sausalito program and our advocacy. And age-friendly advocates and members of the county Commission on Aging, and other stakeholders worked with legislative staff, testified at the state hearings to advocate for passage of the bill, and California Assembly Bill 2132, building permit waiver for seniors, was passed in September of 2018. So rather than issuing a mandate, the bill amends the state housing code to authorize cities and counties in California to create county and municipal ordinances to waive or reduce building permit fees for home adaptations for persons aged 60 or older who have any limiting condition. And so there may be different versions put into place by different jurisdictions to reflect the needs of their unique communities. But all of these serve as an incentive for people to think about and to make changes in their dwellings to make them more accessible. And Marin County is now taking steps to explore making changes to its code and create an ordinance to implement a model that other counties in the state could follow. So with the simplification and cost incentives for permits and public education, we're optimistic about reducing the risk of falls in the home among older persons in our communities while providing an increase in accessible housing stock now and for the future to enable more persons to age in place in their own homes in safety and comfort and good health. So I'd like to thank the World Health Organization, Grantmakers and Aging, for honoring Age-Friendly Sausalito with the Innovation at Home Award, the International Federation on Aging for this opportunity to share our program, and the World Health Organization, and you, the attendees, for joining us. Thank you all.
Thank you, Sybil, for your wonderful presentation. I think you hit on a number of important points, which the first being the desire for older people to remain in their own homes, the danger of falls in limiting people's ability to do that, and then the need to collaborate across sectors to adapt homes for various needs. So thank you for that. At this point, I'd like to switch over to Luis Barrios, and Luis will be presenting on Barcelona.
Thank you, Jessica. Hello, everyone. I'm very glad to be with you. Thank you for a kind invitation. I'm covering my colleague Gemma because of a health issue, so I will try to make my best. So first, my presentation will explain some issues about our organization, our duties, then explaining some key aspects of our program, and finally with some key aspects or results we have obtained through these 10 years of implementation. So we are the Barcelona Provincial Council. We are a network of municipalities. Our objective is to ensure the provision of municipal services and to support the work of government. And our competences are in order to coordinate municipal services and provide technical and economic assistance. I think that our main objective is to create and maintain this network of municipalities to improve the local services and guarantee our territorial equity. So the Barcelona province, we are the largest population in our region, Catalonia. We have 5.5 million of inhabitants, the 73% of Catalonia total population. We have 311 municipalities, mainly small and medium-sized municipalities, and these 311, we only attend 310 because the Barcelona city has their own system. So we have near 200 municipalities that have less than 5,000 inhabitants. So our department, we are in charge of the social welfare, education and equality policies, and public health and consumer affairs. Our mission is to contribute in cooperation, always in agreement with local councils, to ensuring this public welfare. We provide services covering the people's whole life, from the schools and from attending all older people, and always trying to intervene with the most vulnerable groups. So we are a network, and we provide all these kinds of support in terms of technical, material, economic support, training, information systems, social, providing attention and support to social organizations and municipalities. So let me now start talking about our program, the home refurbishment program. The aim of our program is to guarantee minimum levels of accessibility, safety, hygiene, habitability, and energy efficiency in the homes of the most vulnerable, elderly, and disabled people. The energy efficiency is a new feature of the program, so we still have enough information to offer you some results. The aim is to meet the challenge of an aging population. We have the 18% of population in the province is over 65 years, and 33% of them has more than 80 years old. So we try to enable people to live for longer in their own homes, within their communities, their natural communities. So we want to improve their well-being by keeping elderly people in their natural environment, facilitating, community ties, intergenerational relationships, and the environment conducting to a healthy aging. So we think that maintaining their own spaces and networks of relationships, while delaying the need for institutionalization, we also aim to strengthen and improve local authorities' social welfare policies and actions in the Barcelona area. And what kinds of or types of intervention we do in our program? Basically, our interventions aim to improving accessibility and facilitate personal hygiene. If we see the data, mainly we try to replace the bath tube replacing the bath tube to shower stalls. This represents the 73%. But also interventions aim mainly to improve safety with regard to daily activities in the kitchen, general refurbishment as interventions, trying to adapting and providing support in the general home environment to facilitate general mobility of the person in all the spaces at home, and additional actions to improve home energy efficiency. As I said before, small interventions to supplement the above, with the aim of improving energy efficiency in homes, replacing windows or doors. And finally, some technical aids to provide beneficiaries with devices to help them move, communicate, and improve their rest. This technical aids was an innovation in the latest, also in the latest implementation of the program. You can see now some pictures about the bathroom refurbishment, which is the main intervention. Around 97% of the interventions are in the bathroom installations, and 77, as I said before, are replacing the bath tube to more safety devices. About our target group, the program was designed to reach people age over 65 who are in situation of frailty due to age, to health, lack of personal autonomy, disability, or dependence, or living alone or with another elderly person, or with financial difficulties. The local social services are in charge to identify and make an initial evaluation of the person's situation at the cities. And recently, the program was extended to people aged under 65, but with disabilities. Now we have more or less 30% of our beneficiaries are with disabilities and are aged under 65. The priority of the program is oriented to people with financial difficulties, people who have their disabilities or dependency status legally accredited, and people over 80 years of age living alone or with another elderly person. This is the main stakeholders who intervene in the program. As you see, we have many figures, so it represents a complexity in terms of coordination and the management model. We are the Barcelona Provincial Council. We lead and coordinate, and we try to promote and finance the program. And the program is implemented by 3 of our departments. The welfare services within I'm working. We offer the management department, and we are responsible for the design, the preparation, the planning, the public procurement, and funding and communication. Then we also need our internal contracting service, and this department supervises the drawing up of the service and technical administrative specifications for calls for service tenders, and organizes and manages the whole tender process. And we also need the support of our general secretary, who authorizes the administrative specifications. And this is 3 of our offices who coordinate the program. And then we have the company specialized in functional adaptation of homes, and they are responsible for managing the intervention projects, and it provides the program with professional figures as architects, coordinators, social workers, and it designs all the technical framework of interventions and monitor them. And the interventions, the refurbishment, are executed by another companies. They are building companies contracted by Barcelona Provincial Council. Then we have the local authorities as the closest government to the public, and they participate identifying and targeting beneficiaries and homes for the program, and in some cases by co-funding the work. Since the 2019, there is no co-funding for the municipalities, but depending of each situation, they can decide to apply some kind of co-payment for beneficiaries. The beneficiaries participate assessing the program and offering their views, which has helped to adapt and improve the interventions. The partnership approach based on the person's expressed needs. And finally, but not less important, the third sector social organization are very interested in this program, and they help us through the signing and make some kind of publishing the program among their users and referring potential beneficiaries. In terms of financing, we provide the 80% of the budget. Municipalities participate in the 20%, but this since 2019 it is for free for them. The average cost per intervention, I think, is quite high. It's 1.5 thousand euros. So this average cost is for the 2018 and the beginning of the program. So in terms of the impact, well, in the period of 2009 and 2015, a total of 153 local councils took part, covering over 85% of the population in the Barcelona area, the Barcelona province area, and 6.3 thousand refurbishment have been carried out since 2009, benefiting a total of more than 10,000 people. I think the profile of the beneficiaries is mainly women, which represents the 70%. In an average age that cover from the 75 to 90 years old, it represents the more than 60%, and the 55% of people who are beneficiaries of the program lives with other person, mainly a partner. In 2009, the people living alone represented the 11%, while in the last implementation, this was 67%. Thus, maybe this change, we think it's due to possible change in priorities established by the city councils to better adapt more adequately to their users' needs. In terms of effectiveness and efficiency, the data we have of evaluating the program, we have found that more than 80% of cases, beneficiaries are people with a high level of autonomy, and that confirms to us the preventive nature of the program. And in terms of personal autonomy, after the interventions, the percentage of people unable to carry out daily activities at home without help from someone else dropped by 24%. I mean, from 55 to 31. In terms of accessibility, another main goal of the program, the number of people who could not access certain spaces in their home without help dropped by 20% after the refurbishment work. In terms of safety, around 90% of the beneficiaries state they feel completely safe in performing daily activities themselves before the intervention. It represented only the 2%. And in terms of comfort, around 94% of the beneficiaries said they have a comfort in performing daily activities at home, and before the intervention it represented only the 2%. In terms of quality of life, 80% of the beneficiaries improved a lot the quality, and 20% said they have quite improved their quality of life. So I think as conclusions or key aspects of this program, first, we think that age-friendly housing solutions for living better conditions and to guarantee more time at home, it affects the three levels of action: the person, the environment, and our policies. And I think the more a person is in their home, which can affect the living with more autonomy of the elderly, and it facilitates the social activation and the intervention of caregivers and all programs that can also permit to the people live in their homes, like the telecare, like home health services. And secondly, I think it's a challenge, this intergovernment cooperation, because we are talking about the provincial level, the municipalities, the public-private cooperation to offer a home accessibility service to all municipalities in the Barcelona province, including the smallest ones with an older population and few resources. Other governments, bodies in Spain or in our region are trying to implement similar programs, but normally are oriented to offer grants to people and not to contract the companies and to assume all the managing of the program. We also try to make a multidisciplinary approach and a person-centered view, and we try to include the specialists such as physiotherapists, social workers, architects, who, based on a detailed analysis of each situation, propose specific solutions for functional adaptation of the home to the needs of each person. The needs of the person come before the service or solution available, and I think this involves a change in paradigm regarding accessibility, focusing more on functional adaptation of the different elements in the home to the person's characteristics, and it permits to maximize autonomy, not to encourage dependency. The participation of small municipalities under 5,000 inhabitants and rural municipalities in the program also favors the territorial balance and equality in social policies. And finally, we think we are trying to include this gender perspective, because the main beneficiaries of the program have been women and people aged over 80, thus impacting on the most vulnerable groups of elderly people. The fact that municipal social services are responsible for identifying and selecting the program beneficiaries guarantees that it effectively targets people in the most fragile social situations. Finishing, only say that we are now rethinking our management model, trying to planning a best cooperation ways with local services, and trying to a more simple model. Thank you very much for your attention. I will be glad to answer some questions.
Thank you, Luisa. It's not easy to step in at the last moment, and that was a great presentation. In the interest of time, I'm going to switch over to Raquel Castelo Branco. She's from Portugal. So Raquel, go ahead.
So good morning, good afternoon. My name is Raquel Castelo Branco, and I'm the head of the Social Cohesion Department of the Porto City Council. I want to start by thanking the International Federation on Aging for the invitation to participate in this webinar and for the opportunity to present the Aconchego program. This program was one of the 3 winners of the Innovation at Home competition promoted by World Health Organization and Grantmakers in Aging, and we were very honored to receive it. So the Aconchego program was implemented in the city of Porto in 2004 by the Porto City Council in partnership with the Academic Federation of Porto, that is a students' association of the University of Porto. And why did we do it? If we look at the numbers of the last census in Porto in 2011, you can see we had a very aged population. Around 30% of the citizens of Porto have more than 60 years, and almost 31,000 persons with more than 65 years were living alone. And this was in 2011. Today, these numbers are higher, as you well know, due to the increase of average life expectancy. At the same time, the city of Porto has a high number of students in higher education. In 2018, public and private universities of Porto had around 58,000 students that were matriculated. A great part of these students come from other cities or even from foreign countries, and they have difficulties in finding a place to live. So already in 2004, we knew that there were a great amount of older people that lived alone and that was isolated and feeling loneliness. We also had at that time another problem, that was the increase of students that were coming to study to Porto, and that had to find a home that was not cheap. They also had to adapt themselves to a new environment, separated from their original families. Thus, a complementary solution was developed, consisting of a housing system in which older people who have adequate housing conditions host students who need accommodation. So we found a solution to respond to problems. This initiative offers benefits for both parts. It's a win-win situation. For the seniors who share their home, they get a close relationship, they gain company on a day-to-day basis, fight a feeling of loneliness, and age in an active way. For the students who offers their company, they receive accommodation and enjoy a better integration in a new city. And besides the cost reduction, they gain a positive and home-like environment that improves their performance at university. So the main goals of this program are to address social isolation and loneliness in older people, to promote relationships between two generations, to promote seniors' quality of life, and to help students and their families to reduce accommodation costs and facilitate the integration of the students in a new city. So which seniors can participate in the program? So citizens aged 60 or over, to be resident in the municipality of Porto, living alone or with spouse, have adequate housing conditions to accommodate a student of higher education. So which students can also participate? So students enrolled in higher education, aged between 18 and 35, non-residents in the city of Porto, and that have the domain of the Portuguese language. So how do we implement the program? A technical team of the municipality interviews the students and just admits the ones that have the required profile. The same process is followed for older people. The team visits their houses to verify if there are adequate housing conditions and also analyzes the profile of the senior. Then, after an extensive analysis of both profiles, senior and student, the team makes the match between the student and the senior. Then we promote a first meeting without compromise. In case of empathy and desire to move towards integration, an agreement is signed. This agreement defines the rules of the Aconchego program. So then the integration occurs, and at this moment we also support the integration of the student when he moves to the senior's house. So during the period of the scholar year, the pairs are accompanied by the technical team. We make regular visits, we keep contacts through email or telephone, and we promote an annual meeting where we have the opportunity to evaluate the program. Monitoring is vital because it allows us to control and manage unforeseen situations, allowing the adoption of corrective measures if necessary. We also evaluate the compliance with the clauses contained in the agreement that was signed. Concerning the evaluation of the program, we conduct interviews, observation and application of questionnaires to the participants, their families, and also to the technicians. Concerning the results, older people report great satisfaction with intergenerational relationships provided by the program. Moreover, the majority of the candidates say that they want to join the program to have company, especially during the night. The students report that besides the benefit of the cost reductions, they gain a home-like environment that increases their performance at university. So a Aconchego program allows collective benefits since this interaction encourages the creation of informal networks of mutual support through the involvement of local institutions, neighbors, and family members. In fact, the program increases the seniors' quality of life and produces a positive impact on the extended family of both participants. This program can be replicated in other cities, in other countries, where there are isolated seniors and students who need accommodation. So we developed a replication guide that allows replication of the program in other territories. So to finish, I want to highlight that the main constraint that arises in the program is to find the right match, meaning choose the appropriate student to match with the appropriate older people. Therefore, we make a deep and extensive analysis of both profiles to achieve the right match. And after they start living together, we visit their homes regularly to evaluate the development of their relationship. These visits are very, very important for the evaluation of the program since they allow us to understand if we really have done the right match. So thank you very much. I'm available for the questions that you may have. Thank you very much.
Thank you, Raquel, for that wonderful presentation. I think there was a good theme between the last two presentations and the first one as well, which is the importance of community and of remaining in one's own community, and also adapting to financial constraints. So thank you for all of those presentations. We just have a short time for questions, so I'll ask as many as I can, and around 5 after the hour, I will probably stop with the questions. So if you have further questions, again, don't hesitate to contact us. So the first question, which is for everybody, is in the cities and projects featured, is the need to repair poor quality housing a bigger issue than the need to build new housing? So whoever has an answer can go ahead. Okay. Did everyone hear that? Okay. I'll move on to the next question then while you think of an answer to the first one. The next question is, for housing, what were some of the biggest challenges you experienced in balancing public and private interests as you developed and maintained a public-private relationship to deliver your program? Luis?
Yes.
Your thoughts on that?
In our program, indeed, we have two companies. We have contract two companies. One, we could call them experts, and another that are the direct providers of the refurbishment. I think it's a challenge to balance this relationship. and sometimes we feel that the company, the experts company, had a lot of information, a lot of control on the program. So now, as I said, we're trying to change this balance of responsibilities, duties, and at the end of power in the program. So because we are leading this program from the social perspective, not from the architecture perspective, as you know. So we are trying to offer more autonomy to the local services. So because they had the councils, they had their own architects, and we are trying to collaborate more with them. I don't know if I'm clear myself.
You are very clear. Thank you for that answer. The next question is for Raquel, and the question is, what did the demographic data look like for both students and older people, and did you find a discrepancy with regard to gender when you were looking at that data?
You are asking about today, the data for today?
Yes, well, what you presented today. Yeah.
Yeah. Okay. Yes, we had an increase today. We think that today we have around 51,000 people that are living alone. So the numbers increased, and we have more people that are needing this response. I don't know if it was that the answer. I don't know.
No, that's great. Thank you
for that question.
Okay, so the next question is directed at both Luis and Sybil, and the question is, for the funds offered through the home refurbishment program and the age-friendly home adaptation permit policy, where does the funding come from, i.e. the province or state or the municipality, from which budget? Luis or Sybil?
Okay. The funds. Sorry, do you hear me?
Yes.
The funding from I think since the 2019, we are trying to cover all the budget of the program. The main ways for the main budget of the Barcelona Provincial Council comes from the state, but we can administrate it with a lot of autonomy. If always is oriented to the duties of the local from the local government. And the municipalities now are at least this 2019 program edition it's not necessary to them to contribute financially to the program.
Thank you. Sybil, do you have an answer for this question? I can repeat it if you'd like.
Oh, hi. Can you hear me now?
Yes, yes.
Oh, good. Yes, but I will answer this one, but I also wanted to make a quick comment about your first question. I was muted before, but sure. In terms of the age-friendly permit program, the way that works is that the city has put aside a budget amount which they are willing to forego in what they normally would collect for the full prices of building permits that are applied for. And at the moment that is $10,000 per period. And when that amount is reached, then the finance committee reviews the budget and sees if they have more funding for that year to add more to that program. And so far it's been sufficient to cover the costs. So it's really the money that the city is willing to forego, and they allow for it they budget for that in their annual budgeting process. So that's how that works. And then, of course, the individual pays for anything outside of that. And then I just wanted to say one comment about the first question, which is, of course, the question had to do with whether the amount of housing available was as important or more of a challenge at this point than accessibility. And I will just like to comment that housing, the lack of sufficient affordable housing or housing with universal design is a big issue in our city and in our county, in our whole state, as a matter of fact. And so that is an issue that is being very much looked at right now. And there's quite a bit of effort at the state level with a number of bills that have been introduced and budgets that are being looked at the governor's office and the state legislature to deal with that issue, because it definitely is a concern. We are short of housing for sure.
Thank you. That's your comments are appreciated, and glad you were able to unmute. We're closing in on the end of the webinar. There have been a lot of comments on replicating these programs in other places and how people might do that and what materials they might need to access in order to do that. So in our follow-up email, we'll try to make those materials available as much as possible. So I think that this has been a really valuable webinar, and people are really looking forward to follow up from that. So on behalf of the IFA, I wanted to say thank you to all 4 of our presenters, and thank you for taking the time to present your work.
It's been a pleasure. Thank you.
Thank you.
Have a good rest of your day. Bye-bye.
Bye, thank you.